Well, good evening, everyone, and thanks for joining us tonight for this special Just for Kids presentation. I'm Amy Lynn. Tonight, we join together as a community to fight child abuse, to protect our children. Statistics show that each year more than 1,800 children die as a result of abuse and neglect. That is an average of 5 children per day. So how can we protect our kids? How can we spot this abuse? We want to answer those questions tonight. We do have a call-in line. If you have questions that you would like answered by our local experts, you can call the number that is here on your screen. We may ask your question live on the air. We want to begin tonight by introducing our special guest. We have joining us this evening Dr. Seth Brown, Chief Medical Officer at Niswonger Children's Network. And also here tonight we have Tara Chadwell, the Assistant Vice President for Child Health Programs. And thank you both so much for joining us tonight.
Thank you.
Thanks for having us.
Well, certainly when we hear those statistics, that 1,800 children, 5 children a day, scary, alarming statistics. What are we seeing, of course, those nationwide? What are we seeing regionally? What are we seeing in our area?
Yeah, so those are definitely sobering numbers, and the reason that we're all coming together this month specifically is one victim is one too many. Just last year in our Ballad Health system, we did see almost 140 children who sought care within Ballad Health. 55 of those were seen at Niswonger Children's for those types of issues.
And so as we join together this month, you guys, along with many other community partners, raising awareness in so many different ways. And I know you kicked this off earlier this month, Tara.
We did, to really prepare for the month of April and kind of get the community, our staff, our team members, you know, everyone has been through so much over the last year. And so really having a dedicated month to celebrate the children and help get education out was huge. So we did on March 31st, we had an event at Niswonger Children's Hospital to really kick off Child Abuse Prevention Month as we head into April. So we had local CACs, some legislators, some of our team, and really just starting to put pinwheels in our ground to really help signify the importance of child abuse prevention.
And of course, if you drive by the hospital now, you will continue to see those.
Absolutely, and even on the walls, we even had our patients be able to color some child abuse prevention with Scrubs Our Bear holding a pinwheel and a kite. I mean, that's just an easy way to get kids to be involved in Child Abuse Awareness Month and prevention without really understanding the significance behind it, but that we have those plastered on the wall at Niswonger.
How important, Doctor, is all those communities coming together, all the different resources to sort of work together on this issue?
So the teamwork approach is absolutely vital. If you go back just not so many years ago, this was a subject that was taboo, right? Yeah. And when you do have a subject that is secretive, unfortunately, people can use that to their advantage and victimize children. So we really put a lot of effort into partnering with the health community, the children's advocacy centers, law enforcement, school counselors, lots of folks involved to make sure we keep our kids safe.
And you mentioned those numbers at the top of the hour when we were talking about the statistics here. Have you been seeing an increase? Have we seen anything maybe post-COVID or pre-COVID? Did you notice any difference?
Obviously with COVID, it added a lot more stressors to everyone's lives. And unfortunately, when some folks don't have good coping strategies to external stressors, they sometimes can turn and victimize children. And so unfortunately, yes, we have seen an increase.
And certainly when you talk about child abuse, it's like you said, it's a little bit taboo, it's hard to talk about, it's hard to think about. And then how do you teach children about something like this? And I know you've come up with so many different creative ways to kind of get that message out in maybe like a lesser scary way for the children, but to help them to understand.
Yeah, I mean, like Dr. Brown said, there's such a stigma behind talking such a very heavy, conversation. But I think as not only Niswonger Children's Hospital, but all of those wonderful partners that Dr. Brown mentioned, everyone is coming across the board trying to come up with education techniques and fun things for children. I mean, mean, there's so many community events, which I know we can dive into as we go through the show, that all different communities are coming together to really celebrate children. And at the end of the day, that's really what we want to do. We want to celebrate these children because we know that that life can come too fast for some of these kids because of child abuse. So just celebrating them this month at the same time of breaking that stigma behind talking about the importance behind these child abuse prevention techniques and, you know, things that we can help keep these kids safe and educate the families at the same time.
And of course, when we're talking about child abuse, we're talking about several different forms of child abuse. You have the emotional versus the physical. You also have sort of that neglect, which can happen.
Yes, and actually neglect is the most common form of child abuse. And you'll hear us call it child abuse or child maltreatment. It's basically synonymous terms for the same thing, but neglect is actually the top.
Neglect. And when we look at neglect, of course, that's one of those things when kids come in. How important is it that there's a community of support surrounding them to sort of help some of these families, if you will, get back together, get back on their feet to where they can acknowledge this and get through it?
Yeah, well, if you start just at the basics, children need love and support to grow, right? So when they are victims of these types of issues, the community rallying around them really helps them move forward in the most positive way possible.
And Tara, I know you guys really cover several counties in our area. So when we talk about this issue, you're going into not only these metro cities, the Johnson cities, the Kingsports, the Bristol, you're going into these outer line areas.
Yeah, and right before COVID started, we actually came up with the idea of creating a task force at Niswonger, and not only for Niswonger, but again, the entire community of the Appalachian Highlands. So that's a basically going into our second year now. We do have a child abuse task force, and that is both the Southwest Virginia and Northeast Tennessee side. So local CACs, partners throughout the, both sides of the state coming together and talking through what are you doing versus what am I doing, and how can we all come together, because as Dr. Brown mentioned, there is so much that goes into this topic. So not myself, not Dr. Brown, not Niswonger Children's Hospital can do it by ourselves. It truly is that multidisciplinary approach of how we can really come around all communities and make a difference in every child's life.
And so you've been coordinating really those efforts and getting all of those parties at the table.
We have, and it's been huge. Just being able to not only make a difference on our Niswonger side, I know Dr. Brown could definitely go into some of our administration and only Ballad Health and Niswonger Children's differences that we've been able to make around non-accidental traumas and what happens to those kids when they enter our hospital walls. Our Niswonger Children's Network team actually has been going out into our ERs and doing dedicated staff training. We have a simulator that is a shaken baby simulator. And that sounds like, why would you have to even have that? But it is a real life demonstration of what can happen to these babies at a blink of an eye and how it affects them long term. And so being able to go into these emergency departments and train the staff and train what to look for when a child presents into your ER has been game changing.
That has to be heartbreaking. So very real and so important, but also heartbreaking on the other side of things.
It is, but we have to always remember that the way that we can do the best for the child is to make sure that we are clear thinking and make sure that we are working as a team, and we honestly build off of each other to make sure that at the end of the day the child is supported as best as possible.
So obviously a lot of training for the team, not only here in these cities, but just like Tara was talking about, in our outlying communities.
Absolutely, and partnerships with the Department of Children's Services, so important, because if you think about it, a child enters an emergency department and that could be the first step in treatment. But once they leave the emergency department, it's just beginning in terms of the support that they need. So that's where Department of Children's Services can be so helpful, even law enforcement partners, school counselors, any support system that's a positive one for the child.
All right, well, we're going to take a quick break. We're just getting started. Again, if you have any questions that you would like to ask, maybe it's something about community resources in your town or city, you can call the number that is right there on your screen. Once again, this is a Just for Kids special presentation. We'll be right back.
The Niswonger Children's Network is growing. We've added new pediatric ERs in both Kingsport and Bristol. We're adding 2 new floors to our children's hospital in Johnson City. And across the region, we're working with medical providers and community partners so even more kids get the quality care they need. Yes, the Niswonger Children's Network is growing, just like our patients. Learn more at balladhealth.org/hope-rising.
I was involved in an incident in which I received multiple gunshot wounds. I was transported here to Norton Community ER. I was flown to Johnson City. Within minutes after I was transported from the scene, I was in the ER receiving treatment. I really would describe it as priceless to have the health care that we have in the area.
Ballad Health's regional Level 1 Trauma Center at Johnson City Medical Center is proudly recognized among the nation's best for patient safety.
We are Ballad proud. Proud of our team members, proud of their accomplishments. Award-winning healthcare across the Appalachian Highlands. Nationally recognized for quality care. From quality measures to clinical outcomes, the awards are stacking up, building a legacy of superior health. We are Ballad proud.
Welcome back to our important Just for Kids presentation tonight. Again, this is Child Abuse Awareness Month, and tonight we're raising awareness and we're answering questions. We have Dr. Seth Brown here with us, the Chief Medical Officer at Niswonger Children's Network, and joining him as well, we have Tara Chadwell, the Assistant Vice President for Child Health Programs. And once again, thanks for taking your time this evening to join us. We were talking a little bit about some of the signs of child abuse and what we can do as a community to sort of come together. And even if we're not parents, but maybe we're grandparents, or it's in our church, or we can all sort of take this active role.
Absolutely. So we can begin with some of the physical manifestations of child abuse or child maltreatment. So there are certain bruising patterns that may raise awareness or raise concern for non-accidental trauma. You know, if you think about it, kids are falling all the time, and they're bruising their shins. They may bruise their arms, or they may bruise even the front of their head if they fall. But if they have bruising patterns of the ear, of the torso, of the neck, of the buttocks, those are areas that are less likely to be accidental. So those are some of the initial physical manifestations. In the emergency department, sometimes we may see injury patterns or physical exam findings that don't quite match what is being told in terms of how the child potentially injured themselves. In terms of other signs or symptoms, sometimes children can have just nondescript symptoms, so they can have just overall aches and pains that just don't add up. They may have behavioral issues in school. Their grades may regress. So definitely lean on the teachers, lean on those guidance counselors. They may be the first sign or the first person to notice a red flag.
Yeah, it sounds like there's a real pattern.
I think so, and I think the important thing too is, you know, child abuse is one of those things to where it's, you may think you see something or you do see something on a child, but you're scared to take that next step.
Yeah.
And you know, in the state of Tennessee, we are all mandated reporters,
Right.
and that's important to know, and it can be anonymous. It all is anonymous. So making sure that if you see something on a child, don't wait till the next person to make that call. You make that call. You help save the life of that child or continue putting them in harm's way. So just making sure that everybody knows they can be and are a mandated reporter, and to not be afraid to just make that call. You never know what that can change for that child.
Yeah, Tara, I think that's so important because, of course, you think to yourself, what if I am wrong?
Right.
What if I make that mistake? But I'm sure that there are so many other layers that are going to look into that, that if
Right.
indeed it was something that you were, at least you
Right.
made that call, because you just don't know.
There's such a safety net system in place to where we, like Tara said, we are mandated reporters, meaning that if we as medical professionals have any concern, we are required to at least report that concern. That doesn't cast blame on any one person at all. It's not a negative thing in terms of pointing fingers at any one person, but it starts the ball rolling to make sure that the child is in a safe environment. And I'll be honest, quite a few reports that are followed through to completion may come up with, hey, this is an okay and a safe situation. And that's great. That lets us know that the system is working. But the last thing we want to have is regrets, and in terms of not reporting a concern and have a child have a bad outcome. We don't want that.
Yeah, and if you think about it, a child throughout the day is in contact with so many different adults, whether it be school and
Right.
teachers or neighborhoods and churches, and so we can all kind of take that active role to just be aware, that awareness.
We can, and one thing that I like to recommend is have the child hold up their hand and say, name for me 5 people that you could talk to or tell if you happen to be a victim of any type of child abuse or maltreatment. And 3 of those need to be non-family members, okay? Because unfortunately the reality is sometimes perpetrators are actually within the family.
Yeah.
And so 3 of those 5 need to be non-family members that they can feel comfortable chatting with. So someone at church, a school counselor, a teacher. It doesn't have to be one specific person, but it could be a group of people that child knows that, hey, if something's going wrong in my life, I can safely go to those people and they'll believe me. That's the other thing. We need to believe these children when they at least come with a concern. And we know that the process is in place to make sure that the whole story is heard and we make sure that the child's safe, but we have to initially, we need to believe and make sure that the child is safe from a workup perspective.
Seems like we are making progress. Just being able to say that you could have a conversation with your child and talk about these things and have them name and actually talk about abuse. I mean, that was something when we were younger. I don't remember a lot of education on anything like that. So at least there is a message within the schools and the churches and the community to have those conversations.
Absolutely. There are so many, Frontier Health and Coordinated School Health and, the counselors like Dr. Brown mentioned, the schools have done so much. And they're great partners for us on a hospital side, a community side, but being able to be in real time with these kids and wherever they may be is huge, and they are invaluable within the schools.
One of the things that I've been hearing a lot about terminology, these ACEs that you guys have been talking about, adverse childhood experiences. And this is really something that seems like the whole team is kind of surrounding. Tell us a little bit about what that means.
Absolutely. So ACEs, you got it exactly right, adverse child experiences. So if you think about growing up and you witness or are a victim of certain catastrophic events. It could be child abuse, it could be premature death of a family member. There's lots of different things that fall into the category of adverse child events. What we're learning is when a child has experienced those adverse child events growing up, they are at a much higher chance for depression, anxiety, things like suicidality, and even early heart disease. So unfortunately, exposure to these adverse child events early in childhood can actually cut their life expectancy. So it's very, very important that we identify these events early, try to get ahead of them and prevent them to decrease morbidity and mortality later on.
So not only stop the abuse, help them to already begin that process of healing at a much earlier age.
Correct.
Which is the goal for all of us.
Yes.
All right, we're going to take a quick break. We're going to be back. Once again, here is that number. We've been hearing the phones ring, so I think we've got a few questions. We're going to take a look at those during the break, and we'll be back right after this.
I was involved in an incident in which I received multiple gunshot wounds. Was transported here to Norton Community ER. I was flown to Johnson City. Within minutes after I was transported from the scene, I was in the ER receiving treatment. I really would describe it as priceless to have the health care that we have in the area.
Ballad Health's regional Level 1 Trauma Center at Johnson City Medical Center is proudly recognized among the nation's best for patient safety.
We are Ballad proud. Proud of our team members, proud of their accomplishments. Award-winning healthcare across the Appalachian Highlands. Nationally recognized for quality care. From quality measures to clinical outcomes, the awards are stacking up, building a legacy of superior health. We are Ballad proud.
The Niswonger Children's Network is growing. We've added new pediatric ERs in both Kingsport and Bristol. We're adding 2 new floors to our children's hospital in Johnson City. And across the region, we're working with medical providers and community partners so even more kids get the quality care they need. Yes, the Niswonger Children's Network is growing, just like our patients. Learn more at balladhealth.org/hope rising.
Welcome back to tonight's program, Important Information. And again, we want to thank Dr. Seth Brown and Tara Chadwell for being with us and answering so many questions. Such great information as we come together as a community to raise awareness to hopefully stop the child abuse that is happening within our communities. And we were talking about being that person that stands up for the child and says something. And I know, Tara, was saying if you are wrong, which is always, you know, someone's concern. And we actually did have some questions come in about reporting possible child abuse, and specifically for teachers. And do they have some type of legal coverage for making those?
Absolutely. You know, and I think knowing you can make that tip anonymously and making sure that you are just making that call to help that child. You know, at the end of the day, if you suspect child abuse on a child that you have in your classroom, make that call rather than choosing not to, because the alternative, again, may not be a good outcome for that child. So absolutely, you are covered legally, you are safe, make that phone call. You are a mandated reporter as well. You have the option to make that anonymously and just make the call.
And really our responsibility as parents, as adults, to be watching for those kinds of things to protect our kids.
Absolutely. And just remember, we started the show with some numbers, right? 5 children are dying daily in our nation of these unfortunate issues. And anything that we can do to get out in front of this and stop the train before it leaves the station, it's super important. In addition to anonymous phone reporting, there's also an online reporting system through the Department of Children's Services. So they make it very easy to do the right thing.
And you know, they're going to do their homework, they're going to take a look at it, and the worst case scenario, you were wrong, and they say, nope, where this child is fine, and then we can go on. But if you were right, like you said, and certainly here too in this area, we mentioned those statistics that you've been seeing in our hospitals and in our rural communities, and seeing headlines, so we know it is happening here in our town.
You know, and honestly, what I would say is whatever district or region that you're in, if you have questions around how to make tips or how to make a phone call, just call your Children's Advocacy Center in your area. They are a great resource. They work hand on hand with these families on a daily basis, and things that we're not trained from a community standpoint to deal with, of how to help these families or how to just communicate with them. Those are trained staff members that are in your community that can help with the real resources in that specific area. So lean on those folks in your community. You can Google who your Children's Advocacy Center is for your local area and just get to know who they are if you need to make a call and ask some questions.
And sometimes it may be a family that needs help and assistance, and there are so many community resources, but sometimes for those families to find those resources and make those connections can be difficult.
Absolutely. And those children's advocacy centers, we love them. We lean on them so much. They are led by physicians here locally that know the community. They know the strengths and the weaknesses of the community. But it's not just the physician leadership. It's so important to have multidisciplinary support. And those children's advocacy centers, so many different venues of support. So once a need is identified, that's the first step to getting the assistance that they need.
And Tara, I know this is so powerful to have these different events that you have access to these children and these families to talk about the resources that are available. We mentioned a few things. I know you have a couple of other events too coming up, and some things that you guys are doing in the community.
Absolutely. Just a partnership. ETSU and Frontier Health are putting on a fantastic event at the end of the month, really as a closeout to the month, with a Kid Power Once Upon a Time celebration. Ballad Health and Niswonger has been partners with those groups for a long time and participated in those events. And that's very much geared towards celebrating the child at the same time, again, as getting the education out. But kids will come dressed as princes and princesses, and just really comes with a fun play environment that we can still talk to the kids about it in a fun, kid-friendly way, and the adults at the same time are caregivers. So there's loads of things going on in the community. And what I also will say is the Children's Resource Center at Niswonger Children's Hospital, if you have questions of what is going on or what can I do, you can reach out to myself at the crcinfo@balladhealth.org and just be able to connect with me, and I can help with your region specifically on how you can find those resources.
Okay, well, certainly a lot of good information. We've got one more break to take. We're going to take some of your questions here, and we'll be back to wrap things up here in just a minute.
We are Ballad proud. Proud of our team members, proud of their accomplishments. Award-winning healthcare across the Appalachian Highlands. Nationally recognized for quality care. From quality measures to clinical outcomes, the awards are stacking up, building a legacy of superior health. We are Ballad proud.
The Niswonger Children's Network is growing. We've added new pediatric ERs in both Kingsport and Bristol. We're adding 2 new floors to our children's hospital in Johnson City. And across the region, we're working with medical providers and community partners so even more kids get the quality care they need. Yes, the Niswonger Children's Network is growing, just like our patients. Learn more at balladhealth.org/hope rising.
All right, welcome back, and we want to thank our viewers for joining in this discussion tonight as we continue to raise awareness to fight child abuse as we come together as a community. And one thing we have definitely learned over the last 30 minutes is there are teams of people, teams of professions coming together to try to address the problem, and that's certainly the good news.
Absolutely. You know, I always say when I come on here that I love my job, and this is a very heavy topic we were talking about during the break. This is a hard topic to talk about, even as professionals in the field, but it is so necessary and it is so needed, and we love our children, and we just have every opportunity to partner with wonderful organizations. So absolutely, it's an honor to be able to have a partnership with you all to get the awareness out to the community about such an important topic.
And obviously we talked about doing the right thing, stepping up when you can help a child, if not because you're mandated, because maybe ethically it is the right thing to do.
It absolutely is. And again, we're here to break down the barriers. We're here to break down the stigma of what's going on and really talk about it. And I know that there will be a lot of people at home that may feel a little uncomfortable just listening to this topic, and we completely get it. But at the end of the day, if you can take one step to keep one child from having an adverse experience, adverse event, or even death, it is absolutely worth it at the end of the day. So don't miss that opportunity.
Yeah, I always say it's just heartbreaking when you see a child in the hospital, and that's with a sickness or an illness, but something that could have been prevented, something that was done to the child, is just so heartbreaking.
It is, and those can be some of the most devastating cases for our staff members, I'll be honest with you. We really have to make sure that they're taken care of as they care for these children.
All right, and Tara, I know this is near and dear to your heart. You guys continuing to do amazing work.
Absolutely, and as a healthcare system, to be able to have the ability to go out into the community, into our rural areas, and help spread awareness and education is a huge part of what Ballad and Niswonger is doing, is taking it out of the hospital walls and going into the community, because ultimately, we don't want a child walking into our ER with this situation. We want to go to them.
All right, great information tonight. Dr. Brown, Tara, thank you so much for joining us,
Thank you.
Thank you for joining us. We'll be back with more later today.